Hi, I'm Dr. David Hill, and today we're going to be talking about cold symptoms in babies. Now, if you're looking this up, you're probably wondering what's normal and what's not normal. So let's talk about that. Babies certainly get colds. There are hundreds, if not thousands, of viruses that cause colds, and they're probably the most common infection that humans get. Babies, certainly very susceptible. So what are you going to see? Well, they're going to start like everybody else with a scratchy throat, but you may not be able to tell, except they may not be very eager to eat, or they may make some funny faces at you. Then they're going to get a stuffy, runny nose. For the first 2 or 3 days, what's coming out of the nose is probably clear and watery. But after about 4 or 5 days, it's going to change into yellowish or greenish, thicker mucus. That's normal. That is not a sign of a bacterial infection. Your baby probably still has a virus at that point. Now, we used to say, oh, gosh, the mucus is green, get them in, let's start antibiotics. Not anymore. That's old, and it's just not right. So, how do you know if your baby does need to be seen? What if something serious really is wrong? Well, one sign is fever. I don't care what's going on in your baby's nose. If he or she is less than 3 months of age and has a fever that's a rectal temperature greater than 100.4 degrees Fahrenheit or 38.0 degrees centigrade, that baby needs to be seen immediately. That's an emergency, runny nose or none. Now, if your baby is 3 months of age or greater and has an unexplained fever, we still want to see him. If they got a cold, you could give it 2 or 3 days to see what's going to happen with the fever. However, if the fever goes on more than 3 days, we should still see that baby. If the fever is greater than 104, the baby should be seen within 24 hours to figure out what's going on. And if it's over 105, you need to see that baby immediately. Please take that baby to see his or her medical provider or even the emergency room if it's the middle of the night. Now, ear pain may be a sign of ear infections, and not always easy to tell, though, because a lot of babies just pull on their ears starting about 4 or 6 months of age just to check out and see what they've got or to comfort themselves, so it's not very reliable. Let's talk about cough. The cough lasts the longest of any of the cold symptoms, normally 2 to 3 weeks. That said, if your baby is breathing too fast, if you see the skin pulling between the ribs, underneath the rib cage, or over the top of the rib cage, that's not right. If your baby is making a little grunting sound with every breath, a little or his or her nose is flaring with every breath, that's a sign of respiratory distress. Your baby's not breathing very well, and you need to take that baby to see a doctor. Now, how long can a cold last? Well, the cough we know goes 2 or 3 weeks. The rest of it should get better in a time period of 7 to 10 days. If it's going on longer than 14 days, we're probably dealing with possibly a sinus infection, allergies, or something more significant. So do seek care at that point. Talking about cold symptoms in your baby, I'm Dr. David Hill.